I did my undergraduate training at Ohio State in Columbus, Ohio, and then went on to do my medical school training here at Rush University, which has been a great experience. And then following that, I moved to New York, to NYU for orthopedic residency. And then following that, I did my hip and knee reconstruction fellowship at Ortho Carolina in Charlotte, North Carolina. If a patient sees a person who's specialized in the nature of problem that they're facing, I think just by being specialized, we get more exposure and we feel a lot more comfortable taking care of more difficult joint replacements or revisions that may come through. And I think just having that exposure gives us that comfort level of being able to handle these problems. So I think it's very important for me to get to know my patients, understand what it is exactly that's bothering them, what activities they'd like to be able to get back to doing. I think that's all kind of very important in me being able to offer them the best treatment options for what they're looking for. I think I like to get to know their whole story and figure out what's going on in order to be able to decide based on that. I think setting expectations is probably a very important part of my job. I think giving patients unrealistic expectations is not the right thing to do. I think by explaining to them what they can expect after the operation they have, whether it's a hip or knee replacement, and seeing what their goals are, and if that's a match, then it might be the appropriate course of action. Then I think it's natural. A lot of patients come in, they have anxiety over having surgery, and I think that's a very natural response. So I think it's actually very critical to sit down and make sure you explain to them what the surgery entails, what the surgery day might look like, what the recovery might look like as well, in order to get them to be more comfortable with what the plan's going to be.